So one of the most highly anticipated trials this year and received a lot of attention was a combination of atezolizumab plus a drug directed against TIGIT. This is a dual immunotherapy approach, and there was superiority of the combination of the two agents together as opposed to the atezolizumab arm. And so this was very encouraging. This was achieved with very minimal increase in toxicity as well. So in many respects, one might argue that this is exactly what had been hoped for in immunotherapy combinations, where you would be able to add a second immunotherapy, which had very low toxicity, but enhance the effects of a PD-1 or PD-L1 inhibitor. I think that the data is encouraging, but still fairly small. There were 130 some patients that were randomized between the two arms. Interestingly, the benefit appeared to be largely driven by patients who were already showing biomarkers associated with response to immunotherapy. The benefit appeared to be driven by patients who had PD-L1 expression in at least half of their tumor cells. And this at least leads to some questions. The atezolizumab alone arm, frankly, did a little less well than I would have expected amongst patients who had such high expression for PD-L1. Similarly, there was a particularly good result in patients who received the combination. I think the big question that the field is going to grapple with until we have larger numbers of patients evaluated with this question is whether or not the difference seen between the two arms was based on some imbalance of patients likely to do well with atezolizumab versus a true benefit of the drug directed against TIGIT. And I think that the time and additional research will answer that question. As part of the presentation, it was mentioned that there is a phase 3 study that is evaluating the role of TIGIT, and presumably in addition to that, there will be multiple smaller studies that may evaluate what exactly its role will be in potentially a dual immune blockade.